My name is Jennifer Waldrop, and I'm a physical therapist, and I've worked for Parham Doctors Hospital for over 18 years. In 1999, I started working in inpatient rehab, and then I also worked in acute care. And then in 2005, I decided that I wanted to move to the outpatient clinic, and I came to the rehabilitation center then. My certification is a certificate in functional manual medicine. The certification is from Michigan State University's Osteopathic School of Medicine. The continuing medical education program there allows physical therapists to come and take courses that they can learn how to use the osteopathic approach in their physical therapy practice. The certification required 7 courses, and it was 191 and a half hours of coursework. I had to take 2 manual medicine classes, 2 muscle energy classes, a craniosacral class, an exercise class, and a myofascial release class. I've also taken 5 other courses that were offered, and so I actually have over 300 hours of education through the continuing medical education program. And for the exam itself, it was the first day we took a written exam that lasted 3 hours. The second day we took an oral and practical exam, and that was split into 5 sections, and that took an entire day to complete that. In 2009, I took a Principles of Manual Medicine course, and that pretty much changed the way that I treated my patients from that day forward. And then I didn't take my second course until 2013, and that was a muscle energy class that I took. And when I took that class, I decided that I would take 2 to 3 classes per year until I completed all the coursework for the exam. And in June of 2016, I took the exam. I mainly treat neck patients and back patients, but I pretty much can treat anyone with the skills that I've learned from these courses. I can teach shoulder patients, hip patients, knee patients, ankle patients, but then on the flip side of that, I can teach neurological patients, balance patients, patients with headaches, patients with TMJ, any type of problem. I can use something that I've learned from the coursework that I've done to help the patient. First, I evaluate the patient, and when I evaluate the patient, no matter what type of problem they have, I always start with their spine. So I always take a look at their spinal mechanics. I'm looking at their backs from the beginning. And then if, for example, if they're a shoulder patient, after I do all of that and I look at that and make sure there's no problem with that, I go to their shoulder and then I treat their shoulder. Start off with manual therapy techniques, and those techniques are called muscle energy techniques. And what I try to explain to the patient why I'm doing what I'm doing is because everything's connected in our body. So you might have a hip problem that's caused by a back problem. You might have a knee problem that's being caused by your hip or your ankle. After I finish with what manual therapy techniques I need to complete with the patient, then what I do is I look at the patient and I see where they need to be stretched and where they need to be strengthened. So we do stretches and we do exercises. At the end of the first session, the patient has an exercise program to do at home, and each time they come back, I may change those exercises and make them different based upon what the problems and the issues are that they have. I feel like this has benefited my patients because in addition to all of the exercises and stretching that I've given them and everything they learn over the course of being in physical therapy with me, I also teach them self-correcting exercises. So the patient knows, based on what we've done together and the way that I've educated them about what their problems are, they can do some self-correcting exercises at home. So once they are discharged, they are able to manage their own pain and manage things sometimes on their own without having to come back to physical therapy. So they're always welcome to come back to physical therapy and get help, but if they can manage it on their own and they're more independent, then I feel like I've made a big change in their lives. This has changed the way I practice because every patient is unique, and so when I'm with a patient, I like to educate them. So I educate them more than probably I ever have, and I want them to understand the biomechanics of the spine. And so when they have a problem, I bring the spine out and I show them what their problem is. And that way they have a really good understanding of what's going on in their spine. And that way when I'm doing my corrections, those muscle energy techniques that I talked about, they understand exactly what I'm doing to their spine, and they understand that what I'm doing and how it's going to help them get better. For my patients, as they come in and they've learned their exercises and they've learned their stretches, I've also added exercises called self-correcting exercises, and those exercises complement the manual therapy exercises. So when patients are at home and they may be having some pain, they can try those self-correcting exercises on their own, and if that reduces their pain, then they're doing some of the same things I've done with my hands, but they're doing it themselves just actively. So they're learning how to manage themselves and to take a big role in their care so that they're really independent in the long run. So once I discharge them from physical therapy, they're able to try to manage this on their own if they do have some further back pain or other pains that they came here for. But otherwise, they can do these things on their own. If they need to come back to physical therapy, they can, but otherwise they're independent now and they are able to treat themselves. After learning all of these things that I've learned at Michigan State, I think the favorite things that I do now are educating my patients, and then when I treat the patient and watch them get better and watch them be able to function better without pain, and they be able to go out and live their lives and have fun and not feel like they're struggling and living with pain, I feel like that is just a joy to see the patients just really go out there and have a good time.